I kept saying that if we pursue this course as a country, that the number of deaths are going to inevitably, eventually rise. Donald Trump stood in the White House with a Rose Garden and basically proclaimed the deaths haven't gone up. Now, the reason that the deaths hadn't gone up had to do with the better understanding of the virus, meaning you have a better way of treating the virus, on top of just having a knowledge and, let's say, a base of getting the resources that you need in comparison to how all of this stuff started. You just have more advantages now than you did when all of this and the pandemic started. So basically, because of all of this kind of new information that's associated with the way they're treating it, well, yeah, you could extend the life of people who are dealing with it. That extension of life translates into a longer period of time that it takes for the death toll to increase. The death toll is now increasing. This may sound like an I told you so, but it's not said it so callously, if that makes sense. It's more so said so with a certain degree of righteous indignation. It didn't have to be this way. That's where this comes from. Take a look at New York Times. After a recent surge in COVID cases, deaths are now rising too. The death toll was nearly 1,000 yesterday, or I think it was like 1,001. The day before that, it was 935. We're getting to the point where the deaths are hitting the thousands and potentially above again. We had, 70,000 people get infected yesterday? Florida, Texas, Arizona, all these places are peaking. This is the New York Times piece, because there's something else I want to add to this that's phenomenal. And that's a leaked document that I would imagine the White House would have never published. The number of states' cases in late June surged higher than the outbreak first peak. At the same time, daily COVID-19 fatalities decreased slightly, leading President Trump to proclaim that deaths were way down, quote unquote. But a divergence may have come to an end last week when the average number of new deaths per day began to steadily start rising again. Public health experts have pointed to a few factors that help explain why the death counts were initially down. Treatment improvement, and young people who are less likely to die from COVID-19 make up larger share of the new cases. So yeah, we are better at treating it, and kids have a better potential for living through it. Additionally, more widespread testing means cases are caught sooner on average. That means that the lag between diagnosis and death will be longer than in March, when tests were in critically short supply. All right. This is kind of a infinitely foreseeable thing to take place. Donald Trump didn't necessarily want to deal with the deaths and the people who were getting infected. He pretended as if everything was hunky-dory, and he just said, let's throw open the doors of the economy. One state after the next decided to do this, and many of these states now are suffering from doing just that. Then you have this come out, a leaked document, right here. Okay, doesn't go that high. That sucks. Basically, a leaked document making the point that an unpublished document by the White House Taskforce is showing that they wanted to shut down 18 states because those states were in what they call the red zone. I wager this document would have never been published by the Trump administration. This is the same administration that pushed to move the HHS, Health and Human Services, to collect the information directly as opposed to having the CDC to do it. There's only one bald-faced reason a person would do this, and that is because you want to have control of the information. Information that does not make you look all that good. And Trump, who has taken a strident policy that he is not going to shut down the economy under no circumstances, well, this document is unfortunate because the bare bone reality of it is you need to make a choice. And the choice that has been made is basically, I care more about the economy than I do about your kids dying in those schools, or for that point, you dying at those jobs. This is a virus that is out of control from the incompetence, flagrant criminal incompetence of the person who's in the White House. Welcome to the Soapbox. My name is Jamarl Thomas. This is the Progressive Soapbox. Guys, if you dig this content, please like, share, and subscribe. You can always support this content through PayPal or Patreon. I'm not going to keep this one long, but it needs to be said. Look, I've said for the longest time that human beings are real things. The virus is a real thing. It intersects with us. And this kind of physical dimension where we can get sick from it proliferating in our bodies. Cash is not. Meaning, if your government has to take measures to ensure that your economy, or for that matter, the people in your society are made whole for the duration of the time that this thing lasts, then you need to do that as a government. It behooves you to do that because, again, human beings matter more because human beings are real. Look, there is nothing backing our currency. And even if there was something backing our currency, let's say gold or whatever, those things aren't really real anyway. Money is just the concept. It's not a real thing. And so it seems appalling to me that we would allow people to go through life with a certain degree of lack when we can basically provide the things that they need. In this case, we took, as a government anyway, the position that we're going to give people a pittance. We're going to let the plutocrats of the world loot the treasury, and we're going to force those people to make a choice that goes against their physical best interests because we need those people back to work. I want my economy to be up and running. I said the economy was going to be my issue, and now the economy is tanking with 30 million people out of work. Well, he's making a choice. He's making a choice to prioritize the economy over human beings. The public sees that very clearly and is punishing him for that from the standpoint of the polling. The other interesting case in this is Dr. Fauci. Fauci was on the outs in the White House. Now, Fauci is on the outs because Fauci has a tendency to be more honest. And in having a tendency to be more honest, the public acknowledges as such and acknowledges him as almost an allegory for science itself. Donald Trump, if he's going to kick Fauci to the side, it makes it look like, which it is, by the way, that reality embodied by Fauci is an impediment to Donald Trump's objectives, which is to con the American public into believing that everything is great and that this virus is just running its course and that the high count of infections is explained by the increase in testing. Pay no attention to the ICUs, pay no attention to the refrigerated trucks and the morgues overflowing in many of our states. And now you get a report like this. He needs to keep Fauci by his side because the public, when you're looking at the polling, on broad terms, considers him a liar, especially on this issue of COVID-19. They do trust Fauci. If you're kicking Fauci to the side, it makes it look like you're kicking reality to the side because it's getting in your way in regards to what you want to do politically. That is not going to be looked well upon. So, bending to political winds, he hugs Fauci, talks to him for a couple of minutes. First time in months. Here's the thing. This document is damning because this document basically makes the point that 18 states are in the coronavirus red zone, and those states need to roll back their policies to phase 1 in order to stop the spread because they're terrified that the numbers of infections are going to get to 100,000, 150,000, 200,000. Keep in mind, and remember what they said about New York. Do I have this up? That basically the study showed that just a week of, right here, where study showed just a week in the delayed lockdown cost 36,000 lives. What does it look like today where you're at the peak? And these guys aren't rolling anything back. California has started to do so, but Georgia doesn't even force face masks, which is astonishing. I mean, of all of the weakest measures that you can take in order to ensure that the public is safe, how can you not mandate that? Why wouldn't businesses even want that? I mean, those businesses need to have a waiver for each and every person that walks in that door that, yes, I am okay with shopping at the store and I may get ill because there are going to be people who are walking here without a mask on. And I may die, but I really wanted this t-shirt. So, I can't sue and my family can't sue. P.S. Trump forever. I'm just saying, what does that look like going forward in a week or 2 weeks or 3 weeks or a month if we're not actually taking decent action for this? And then they're trying to send kids to school on top of that. This leaked document right here. So the red zone is defined in the 359-page report as those core-based statistical areas and counties that during the last week reported new cases above 100 per 100,000 population and a diagnostic test of positivity of 10%. The report outlines measures counties in red zones should take. It encourages residents to wear a mask at all times outside of the home and to maintain physical distance, and it recommends that public officials close bars and gyms and limit social gatherings to 10 people or fewer, which would mean rolling back reopening provisions in those places. Here's another part. The following states are in the red zones for cases: Alabama, Arkansas, Arizona, California, Florida, Georgia, Iowa, Idaho, Kansas, Louisiana, Mississippi, North Carolina, Nevada, Oklahoma, South Carolina, Tennessee, Texas, and Utah. The following 11 states: Alabama, Florida, Georgia, Idaho, Louisiana, Mississippi, North Carolina, Nevada, South Carolina, Texas, Washington. The 11 states in the red zone for tests of positivity, meaning the above 10%, with the exception of Washington State. Now, the spokesperson for Vice President Mike Pence did not dispute the document's authenticity, meaning the document is legit. But this is what they've cast this as. This is encouraging signs amid the pandemic. When the vice president held the White House Conference Taskforce press briefing in the HHS a few weeks ago, he reported that 16 states met the criteria for rising cases and rising positivity rates. As it stands in the report, there are only 10 states that fit the criteria. This is just one data point of many encouraging signs that we are seeing across the country as we continue to respond to the COVID virus pandemic. O'Malley said in a statement. How much bullshit can come out of a person's mouth? That's phenomenal. This report, White House's own task force is saying, shut it down. You're going to get people killed. There are already nearly 40,000 people dead. That number is going to start spiking that much higher. Shut it down. Somebody had to give them this report, meaning somebody saw this and was so bothered by the fact that they were going to go with a policy that directly contradicts what their own task force is telling them to do in order to save life and limb. Meaning, if you had any rationality of action with the notion that I'm going to take the act that saves the most in regards to life and limb, Trump decided to do the opposite of that and went with the notion that, yeah, this ain't going out. This report ain't going nowhere. Now, I don't know if Trump made that explicit choice or if somebody else made the choice, but the fact that Mike Pence knew about it would give me some idea that Donald Trump probably also knew about it. And I have a hard time believing that the White House was going to release this on their own. I could be wrong, and if I am, I apologize, but I have a hard time believing it. My point is, this report coming out is damning, utterly damning. You're going to get kids killed. You're going to get people killed. And you're doing this explicitly for political reasons. There should be some rationality in the case of how do we save life and limb, how do we ensure the people of the country remain healthy. There should be some philosophical responsibility, regardless of how diminutive you might even see it, to ensure that people are healthy and safe, the welfare of the nation of sorts. This entirely says, fuck that. I don't care that those people are going to get ill. I have a political identity that I need to attend to, as opposed to the real life affairs of the nation. This is abominable. I mean, you must understand how horrible this is. Your president has taken a specific position, let the weak die off, while he himself surrounds himself with people to ensure that he stays safe in all of this, because they can clean the areas and everything else to ensure that he's protected in his little presidential bubble. Like, share, and of course, subscribe.